Hello, everyone. I'm Dr. Anandaraj, professor in the Department of Pediatric and Preventive Dentistry, PMS College of Dental Science and Research. Today, I would like to discuss on infective endocarditis prophylaxis. Before, we had a custom of giving antibiotic prophylaxis for all congenital cardiac diseases. Now, it has been changed that only for those conditions means those with high-risk conditions, you need to give antibiotic prophylaxis. And this antibiotic prophylaxis, which I'm going to discuss with you, is according to the American Heart Association 2021. There is slight change in the previous guidelines. The new guidelines is according to the American Heart Association 2021. And according to these guidelines, you need to give antibiotic prophylaxis for only those conditions which are high risk. For other conditions, you don't require any antibiotic prophylaxis. And the infective endocarditis can be prevented by proper oral hygiene. That is, maintaining the proper oral hygiene by proper toothbrushing, either with the manual toothbrush or with the power toothbrush or ultrasonic brushes. We can use it, dental flossing, and thereby we can prevent the infective endocarditis. And only on those conditions where if you're manipulating on the gingival tissues and on this high-risk group, you need to give antibiotic prophylaxis. With this, let's go to the which are conditions you need to give antibiotic prophylaxis. Antibiotic prophylaxis is reasonable. Again, that word, please make a note on this one. It is reasonable before the dental procedure on manipulation of the gingival tissues. Like, suppose if you're doing a periodontal ligament injection, or if you're placing a band, or if you're giving any retraction cord or anything in the gingival tissue, or if there is bleeding from the gingival tissue, you need to give antibiotic prophylaxis. On other cases, you don't need to give antibiotic prophylaxis. Suppose if you're doing a class 1 restoration, you require antibiotic prophylaxis. So if at all, if there is any bleeding from the gingival tissue, it is reasonable to give antibiotic prophylaxis. Another condition is that periapical lesions or periapical region. If you're manipulating on the periapical region, suppose if you're doing a root canal treatment and if your instruments go periapically in an open apex cases, in such cases, you might need to give antibiotic prophylaxis. On other cases, if you're sure that your instrument is you're not manipulating the periapical tissue, you don't need to give antibiotic prophylaxis. For example, if you're giving a post and after endodontic therapy, if you're giving a fiber post, you don't require antibiotic prophylaxis. And those conditions where there is perforation of the oral mucosa with valvular heart disease, you need to give antibiotic prophylaxis. Again, it is reasonable to give antibiotic prophylaxis. And there are conditions where you don't require antibiotic prophylaxis. That is routine anesthetic injection through the non-infected tissues. We don't require antibiotic prophylaxis. For example, if you're giving an inferior alveolar nerve block, or if you're giving an infiltration without an infection in the local area, you don't require antibiotic prophylaxis. And if you're taking a radiograph, you don't require antibiotic prophylaxis. If you're placing a prosthetic or an orthodontic appliances in the oral cavity, you don't require antibiotic prophylaxis. Adjustment of the orthodontic appliances, we don't require antibiotic prophylaxis. Placement of the orthodontic brackets, you don't require antibiotic prophylaxis. But on the other side, if you're placing an orthodontic band and that band goes subgingivally, and if there is bleeding from the gingiva, you need to give antibiotic prophylaxis. But on other condition, if you are replacing a bracket or if you're placing a bracket, you don't require antibiotic prophylaxis. Shedding of the deciduous teeth, again, you don't require antibiotic prophylaxis. And bleeding from the oral cavity, again, because of trauma, you don't require antibiotic prophylaxis. Rustral conditions, you need to give antibiotics. So the conditions where you need to give antibiotic prophylaxis are bleeding from the gingival tissue, you need to give antibiotic prophylaxis. Other conditions, you don't require antibiotic prophylaxis. So what are the high-risk conditions? Let's see what are the high-risk conditions where you need to give antibiotic prophylaxis. Those high-risk conditions are prosthetic cardiac valves, that is, including transcatheter implanted prostheses or homographs. If anything is a prosthetic cardiac valves is a, you need to give antibiotic prophylaxis. Or if there is any prosthetic materials, that is repaired cardiac valves, or something is there, like annuloplasty, cords or clips, if it is there, then you need to give antibiotic prophylaxis. And if the patient is having previous history of infective endocarditis, then this child belongs to high risk category and you need to give antibiotic prophylaxis. Unrepaired cyanotic congenital heart defects. So again, please make a note that unrepaired cyanotic congenital heart diseases, you don't require antibiotic prophylaxis. Only those cases where there is cyanosis. In cyanotic heart congenital cardiac disease, we require antibiotic prophylaxis. And on those cases where there is repaired congenital heart disease with residual shunts or valvular regurgitations at the site or adjacent to the site of a prosthetic patch or a prosthetic device, you need to give antibiotic prophylaxis. So please make a note, unrepaired cyanotic thing, you require antibiotic prophylaxis. Cyanotic, this one, you don't require antibiotic prophylaxis. Repaired congenital cardiac disease with some residual shunt or valvular regurgitation, then you need to give antibiotic prophylaxis. And the cardiac transplant with valve regurgitation, you need to give an antibiotic prophylaxis. So only these conditions are considered as a high-risk group, and only for these conditions you need to give antibiotic prophylaxis. Rest of the congenital cardiac disease, you don't require antibiotic prophylaxis. Please make a note, you don't require antibiotic prophylaxis for the rest of the congenital cardiac disease. Only for these conditions, you need to give antibiotic prophylaxis. And the antibiotic prophylactic regime is, you need to give antibiotic prophylactic regime 30 to 60 minutes before your dental procedure. Either it can be given IM or IV. If the patient can take orally, then amoxicillin, it is 2 grams for the adults and it is 50 milligram per kilogram body weight for children. If the patient can take orally. And if the patient cannot take orally, the drug of choice is ampicillin, again 2 gram IM or IV, or 50 milligram per kilogram IM or IV for children. If not ampicillin, the other alternative is cefazolin, again 50 milligram per kilogram IM or IV, or ceftriaxone, 1 gram IM or IV for adult and 50 milligram per kilogram IM or IV. So for amoxicillin, ampicillin, and cephalosporins groups, it is the dose is same, that is 50 milligram per kilogram body weight. So it is easy to remember, that is amoxicillin and cephalosporins belongs to the same group of drug. So the drug of the dose is almost equal, or it is equal, that is 50 milligram per kilogram body weight for children, and it is 2 gram for adult IM or IV. And if the child is allergic to penicillin or ampicillin, then the drug of choice is cephalexin. Again, there is a caution you have to take it, that cephalexin has to be given carefully for those who are allergic to penicillin. It is always better to give azithromycin or clarithromycin or doxycycline if the patient is allergic to penicillin. And the dose of cephalexin is 50 milligram per kilogram body weight. Again, that belongs to cephalosporin. Or you can go for azithromycin or clarithromycin, 15 milligram per kilogram body weight, 1 hour before procedure, 30 to 1 hour before the procedure. Or doxycycline. For an adult, it is 100 milligram 1 hour before the procedure. Or if the child is less than 45 kilograms, it is 2.2 milligram per kilogram 1 hour before the procedure. And if the child is more than 45 kilogram, you can give the adult dose, that is 100 milligram per kilogram body weight. And here, please make a note that your previous guidelines, instead of doxycycline, it was clindamycin. So this clindamycin has been changed to doxycycline. So this is according to the new guidelines, American Heart Association 2021. So please make a note that when you're writing this one, you have to write that American Heart Association 2021 guideline. And in your textbooks, it will be clindamycin. It will be instead of doxycycline, it will be clindamycin. Again, you might have a doubt that doxycycline can cause, the disadvantage of doxycycline is the discoloration of the tooth. So it has been said that if you're giving this doxycycline for 2 weeks, continuously for 2 weeks, there won't be any effect on the teeth. If it is been given more than that only, there will be discoloration of the tooth. So we are giving a single dose of doxycycline, so that may not cause any discoloration of the teeth. So the concern of discoloration of the tooth can be overruled if you're giving doxycycline for a single dose. And if the patient is allergic to penicillin or ampicillin and unable to take oral medication, then again you can go for cefazolin or ceftriaxone, that is 1 gram for adults, and it is 50 milligram per kilogram body weight, IM or IV. And you can have a note on this one. For ampicillin, amoxicillin, and cephalosporin, the dose is 50 milligram per kilogram, IM or IV dose, 30 to 60 minutes before the procedure. For all cephalosporin groups, ampicillin and amoxicillin groups. And only the dose which you need to remember is that azithromycin and clarithromycin, it is 15 milligram per kilogram body weight. And for the doxycycline, if it is less than 45 milligram, it is 2.2 milligram per kilogram body weight. And if it is more than 45 kilogram, it is 100 milligram, that is adult dose you need to give. So it is easy to remember. And suppose if you are giving an antibiotic prophylaxis, the second dose, if you're giving an antibiotic prophylaxis today, the second dose has to be scheduled only after 1 week, so that we can prevent the antibiotic resistance. And if at all you want to give an antibiotic prophylaxis in between, ideally it should be 2 weeks. And if you want to give an antibiotic prophylaxis in between, we can go for the next drug. That is, if you're given the amoxicillin as the first drug, then in the second dose, if you want to give in between 2 weeks, you can go for cefazolin, or you can go for azithromycin, or you can go for the clarithromycin. So likewise, you can change the antibiotics, and thereby you can prevent the antibiotic resistance. And again, suppose if you haven't taken the antibiotic prophylaxis, well, in between the procedure only, you came to know that the child is having some high risk group, you can give the antibiotic prophylaxis in between the procedure also. So during the procedure also, you can give the antibiotic prophylaxis, and thereby you can prevent the the infective endocarditis. The risk of infective endocarditis can be reduced. So hope you have got some idea about the infective endocarditis. Thank you for your patient listening.